Are live. Welcome back. I am so excited. Today is my second interview with the Lipedema Foundation. Today, I am having a very special guest with us, and I'll introduce her in just a minute, but she's going to be able to answer all of your lipedema questions. She's got a lot of information that she's going to deliver here today. So, while we wait for her to get on, welcome. If you have lipedema, if you think you have lipedema, go ahead and put a heart down below and drop your questions in the comments. If we don't answer them on the live, because there's going to be a lot of information, we will come back afterwards and try to answer as many questions as we can. So that'll be the protocol here. But yay, I'm excited. Thank you guys for hopping on. I know this is new for a lot of us. I personally just discovered lipedema not too long ago. And so if you're on here trying to get your information, get facts, you've come to the right place. This is exciting. I'm really glad the Lipedema Foundation is hosting these throughout the month. If you found me through them, you are already utilizing your resources. I'm happy for you. All right, let's see if we can get her on. All right, she should be on here in just a second. You think your mom has it? Is there a test you can take to know they have it? Okay, let's wait for a specialist to come on because she's gonna have a lot of information about that. I will ask her your question. That's a good one. Getting tested or diagnosed is a huge process for a lot of us, myself included. It does not come easy. All right. Oops. I think we may have a technical difficulty, so give us a second. Hang with us, don't go. There's going to be so much good information right here in a second. I drank a lot of coffee before this interview because I was a little bit tired, you guys. Really long, really festive weekend here with the family. It was really good. Welcome. Hi. I am so glad you guys are hopping on. We are about to do another lipedema interview. I have a specialist coming on, a surprise guest, and you guys are going to love her. She has a lot of information to share. So if you have lipedema or you think you have lipedema, put a little heart down here below so I know. And then if you have questions, ask them. You drop them in the comments. I will ask an interview style ask the questions on your behalf, or she can just see them right there and we'll get them answered. So this is going to be very, very helpful interview. We just got to get her on. We got to get her on. Let me see. Let me check again. All right. You guys are so loyal coming right on here. You see a live and you hop on. I'm really excited. I wish I had a live to watch like this when I was first diagnosed. This was a couple months ago, but still, I mean, how helpful would this have been? I would have been all up on the live, commenting and typing and trying to get as many questions as I possibly could have in. It's very helpful. Okay, let's see what we got here. Okay. All right, one more time. Let's go back. Yee. Sorry, you guys. I think we're having a small technical difficulty. I promise she'll be right on. We've got some support on the back end coming. All right. I think we may have her. Very exciting. See. Hi.
Hey, how are you?
I'm wonderful.
Well,
Welcome.
thank you. Thank you for having me on this.
Oh, I'm so excited. So, everybody, if you're watching, well, you are. If you're here, you have clearly heard of lipedema, and you probably know somebody who has it, or you think you have it. It's quite popular. You're likely to see it everywhere. It's quite common. But lipedema knows no boundaries, right? So there's
That-
no boundary as far as race or age or anything. So I've brought a specialist in today. We have Anna Pazzoli with us.
Thank you.
Welcome. She's a physical therapist. She is a certified lymphedema therapist and lipedema expert. So if you don't mind, I would love to pick your brain.
I'm
And
here.
okay, perfect. We've got a lot of questions. Lots of questions.
Good.
Lots of us are new to lipedema, myself included. And so it's kind of like uncharted territory. And yeah, there's a lot going on. So can you tell me how you first were enlightened to lipedema, or what your knowledge on that looked like for the first time?
Yes. I it goes back. I've been doing. I'm a certified lymphedema therapist for over 22 years now, and when I became a certified therapist, we learned a lot about lymphedema, and this whole process takes me back to some doctors referring patients to me that actually they thought it was lymphedema. So they would send a referral and they would say, oh, well, it's a lymphedema, do the wrapping, do the treatment that you do, and do your magic kind of thing. And at first, I was a newbie at this, and I started treating the lipedema patients the same way I would treat my lymphedema patients without that basic knowledge. And that's where I started picking up, wait a minute, this is very different. Because normally, as a lymphedema therapist, I would do my manual lymphatic drainage. I would do the skin care, do the bandaging, the exercises, and that is, the complete decongestive therapy that works wonders with lymphedema. However, when I would get a patient that comes in and presents a little bit different, and I could feel that something wasn't the same as lymphedema, it wasn't that fibrotic tissue, the fluid was a little bit more rubbery, it felt different. But I was a newbie, so I complied with what the doctors were sending me. And I would wrap these patients, do the manual lymphatic, the skin care, sometimes wrap them and say, okay, you're going to tolerate this until tomorrow or 2 days on, and it's going to feel great, because that's what I was used to hearing from my lymphedema patients. By the time they got to the parking lot, they were calling me from the car. It's like, Anna, this is killing me. I don't know why it hurts much. And so it happened with maybe 2 or 3 patients. Then I said, this is not the same category of lymphatics. I said, this has to be something totally different. And it kind of sent me into like a search, and I started looking at the different things. And yes, we did. I can't say we didn't hear the word lipedema, but really our emphasis in our course was more about the lymphatics, the open wounds, the upper extremity lymphedema. And so I went into a deep dive into lipedema, and I said, oh, wait a minute, there's got to be something different. And that's where I started educating myself more about it, learning, doing more research, and treating them a bit different. So that's where it all started almost, 22 years ago.
Good. Well, your spidey sense was right. They're totally different.
Very different. Yes.
I love
Yes.
that. That's a great story. Can you tell our viewers some of the differences? Because I mean, it is very confusing. Lymphedema and lipedema, they sound so much alike.
Right.
And I think a lot of us are like, well, what's the difference? Because even when I was speaking to my doctor about lipedema, she goes, oh, you mean lymphedema? And I'm like, no, I mean lipedema. So yeah, can you give us a little more information on like maybe what the differences are?
Yeah, so naturally looking at a patient, as soon as they come in, look, I can almost diagnose it now if I'm at a mall, walking at the supermarket,
Yeah.
because the obvious difference is, the body composition, where the women tend to be smaller in the torso, very slim in the abdomen, and then the hips and the thighs will flare out, and even the buttocks. So that to me is a structural difference that most lymphedema patients will not present, because depending on what type of lymphedema, if it is bilateral, both lower extremities are swollen because of some treatment that they receive, whether it was cancer or whatever other reason they have lymphedema, it may just be on one extremity. That's not the case with lipedema.
Mm-hmm.
And the other difference is that usually with lymphedema, you have swelling on the top of the foot, which we call the dorsum of the foot. And those patients have really difficult time finding shoes to wear, the lymphedema patient. Lipedema patients, they always have the cutest shoes on. They have the best pedicures and everything looks great on the, there you go. And the feet and the hands are usually spared, except in later stages. So later stages, that can become a component of it as well. But in the earlier stages, the feet are fine. And sometimes they will have what's called a cuff sign, like right at the ankle, almost kind of overlaps onto the foot.
Mm-hmm.
Not everybody, because there's so many different types. So that's the difficult part about lipedema, is that you have all these different types of body compositions that you really have to look at your patient individually. No two lipedema patients are the same. Some other aspects of lipedema are that the tissue feels rubbery, and you have what we call little granular tissue in the thighs, sometimes the arms, and they're very painful. Lymphedema normally does not present with any pain at all.
Mm-hmm.
As a matter of fact, sometimes it takes a lymphedema patient to find out from a doctor that they have lymphedema because there is no pain related to it. Where most of my lipedema patients, not all, but most of them have painful legs or even arms, wrist areas, depending on what their jobs are as well. Because if you're using your hands a lot, that can become an issue for them. So those are the major ones. Bruising easily, that's another thing.
Yeah.
You don't see that in lymph. You wake up and it's like, who beat me up?
Yes, absolutely. I speaking firsthand, I do that often. Yesterday, I looked down and I go, well, where did this come from on my calf? And it was our 4th of July party. I'm more than certain, just probably just looking at a firework or something just did it. But yeah, I mean, it definitely affects your quality of life. I think there's a lot of facets that you don't realize. I mean, I've lived with this my whole life. I just now got the diagnosis, but I just thought this was me and this was different. And I was just made this way, you know, which I am. But realizing that it was lipedema and not just me being different in another way was a key component for me, because it made me feel like my life was hindered and I had all these different things from somebody else. I was like, why? I don't understand. But there's limitations in mobility, pain, and it takes a physical and emotional toll. So I'd like to know, what are some of the most challenging symptoms your lipedema patients complain or bring forth with you? What do they say?
Well, the emotional component, I think I serve two types of therapies, but I can only charge for one, and that's the physical therapy. Emotional therapy support that I provide for my patient, I would do it free any day, because they need the emotional support and what they've been through, including in the healthcare field, that most doctors will dismiss you. They will not understand, and they, like they did with you, try to correct you and tell you, oh, you mean lymphedema? I wish I had a penny for every time I've heard that from a patient. I probably could retire. So so that is one of the biggest challenge, and trying to make them feel like, look, this is not your fault that you are like this. This is part of it is hereditary, genetic components, connective tissue disorder. It's a disease, really.
Right.
It's not something that, oh yeah, I just want to sit on the couch and become this person. It's not. So, and then the second major challenge I have is most of my patients have limitations with their mobility.
Yeah.
Which it could be having their knees, because when you start to see the body type where your knees become almost like a little bit of knock knee, that's because of the lobules that form. The adiposity that is in that area starts to deposit, and it starts to pull your knees in together like that. So I have a lot of older patients that they never knew they had lipedema, and all of a sudden now later on in life, they're requiring total knee replacements, total hip replacement as a result of just the spiraling changes in their bodies, biomechanics. And
Mm.
the thing is, it's another common factor that most lipedema patients have flat feet, what we call pes planus. And by having the flat feet, it creates issues with either plantar fasciitis, issues with walking,
Yeah.
ankles, easily spraining their ankles. So all of
Yes.
these things, yes, it plays a big role. So those are the challenges, because now you already have an issue with your walking abilities because you feel like you're carrying these extra. I told one of my patients today, as a matter of fact, I said, you probably walk around like you're carrying a bag of bowling balls. And so that's very heavy in order to be able to walk easily with the family, with friends. You can't do the things they can.
Mm-hmm.
Now you add possibly an injury to your knee or to your ankles, it can be devastating. So then, of course, if you go to a doctor, first thing is like, well, you really should lose weight because then you'll feel better.
Yeah.
They have no clue what most of my lipedema patients have been through as far as their, dieting and what they've tried to do to make it better.
Right. Yeah, I think you're right. There's a lot of stigma about it. The first thing a lot of physicians say is this is just generalized obesity. You need to cut calories, move more, which is all great things, but at the end of the day, it is not just obesity. It's very, very different.
It's very
And
different.
yeah, there's a huge stigma. There's a lot of shame, I feel, a lot of miseducation as a patient, as a person. It's just very, very different. Um, can you elaborate and maybe expand on the difference between lipedema and just obesity?
Yes, absolutely. So with lipedema patients, they would have, like I mentioned before, painful leg syndromes. And, they, anything touches, if your pet will walk on your lap, they can either leave a bruise and it would hurt. Um, where someone with obesity, they probably would not feel that. The major difference between those two is that an obese patient, if they're put on a proper diet, they will lose the weight. With lipedema, they are resistant to so many. I mean, and I know most of my patients probably have tried every type of diet in the book, and it's very hard to lose it.
Mhm.
It's trapped in the tissue, where someone with obesity, they usually present a little bit different as well. They have it more in their abdominal area, not as much concentrated on the hips and the buttocks, where lipedema, sometimes you may even see it in the arms. And but when you see a lipedema patient, usually their torso, it's a lot smaller. They're smaller in through the neck. Many times the arms are not involved, and it's
Yeah.
just the lower extremities. Um, as it progresses, it can add on to other areas. But that's the major difference, that, the resistance to diet with lipedema, that is one of the things that I always ask the patient, have you tried weight loss? And, oh, I've tried everything. They could write the book on every type of diet that they've done, because, they want to achieve. It's not like they want to stay in this form forever. So what ends up happening is they become experts in all kinds of nutritional components and diets and supplements. And if it was someone who was just obese, they would have had some results.
Some kind of progress. Yeah.
Absolutely. Yeah.
Okay, so that begs the question, what does work? What are we supposed to do if we have lipedema? Like, what therapies have you found that are effective or that, help us out? Give us your
Yeah.
give us your
Uh,
expert opinion here.
So when my patients come in, I always tell them, look, you're coming in with an empty toolbox. My job is to give you tools. And I have found that there are many tools out there that can be helpful. I'm not saying that this is going to take care of it. And I know nowadays the whole platform with lipedema is changing into surgeries, into different things. But there are many patients that are not candidates for those things. So I give them a bunch of different tools. The main tool that they come in here for is what I do. As a lymphedema therapist, I was trained to do manual lymphatic drainage. And that's the meat and potatoes of what I do. I do the entire body. I worked with them to try to decongest that toxicity that is trapped in the adiposity of their legs, their arms. Um, and I always kind of tell them that, look, as soon as we're done, you're probably going to have to get up and go to the bathroom, because that's how quick this would work. Most of my
Mm-hmm.
patients have to get up and go immediately to the bathroom to urinate, because we're opening up channels in order to get some of the trapped fluid that is in the tissue. There is adiposity, which is present. That is not something that I can push through the lymphatic system. But the extra fluid that's contained there, that's quite easily to do. And the best way to follow up with that is telling patients to use some form of compression. Now, not all compression works for lipedema patients because their skin is very sensitive. So there are certain types of leggings that would help. Also, exercising. For me, the best exercise recommendation is aquatherapy.
Mm-hmm.
Look, in a tiny little pool, just getting your legs in there, moving about. It should be more than 3 feet or 4 feet, so that you have the pressure right on the skin. That is like having 2 pairs of compression socks on. That's how well the pressure of the
Wow.
water works. And if you're moving, you're activating your lymphatic system. It's going to help decongest.
Like a two for
And
one.
exactly. But the other thing too is that because of the buoyancy of the water, you are not going to feel the pain that you do on land. So if you walk in the pool, you can go on forever, versus walking outside. You'll feel the heaviness, the tire, the
Yeah.
fatigue, all of that will set in, immediately. So that's my main component that I tell them. If you have access to a pool, that is the best thing to do. Now, other things that we talk about is like dry brushing, performing
Mm-hmm.
like self MLD with a brush, activating your lymphatic system. Um, that's another one of my big components. Diaphragmatic breathing, trying to like relax yourself. So because the cortisol in the body plays a huge role on the lipedema fat. So by trying to do like the breathing, that kind of relaxes the patient as well. And at the same time, the diaphragm works in the entire lymphatic system, almost like an internal massage to get that fluid moving.
Mm.
Okay. So that's another thing. So exercise, whether it's pool or outside, some patients love to work out in a gym, but I have found that some patients may overdo it and they can hurt
Yeah.
them. So I, do, a little bit at a time, work yourself up to things. Don't try to do, the high intensity interval training 4 times a week, because it may be too much and you may have joint pain, which it's another inflammatory response.
Mm-hmm.
And of course, we discuss eating healthier, staying away from processed foods. I don't promote any one specific type of diet because, like I said, lipedema patients, they all have different ways of dealing with it. They have different bodies. They're at different stages. So I can't just say, oh, this is going to work for all of them. So I have
Right.
to really analyze to what it is that they need.
Tailor a plan.
Right. And then there's also like some other things, like they could use a pneumatic device for their legs, for home vibration plate. That's another thing that stimulates the lymphatic system. So those are like the main tools that I would give to my patients to use on a regular basis.
Is there always swelling in lipedema, or is that sometimes not an issue for everybody with lipedema, swelling?
So not everybody. I have some very early stages of lipedema. I recognize it. It's lipedema, but they don't have the swelling yet, but they have the painful fat disorder.
Okay. So
So
it's
if
a progressive kind
yes.
of, and there's stages of lipedema, correct? Can you kind of maybe briefly walk us through what the stages are? Because I've heard a lot of different things about stages too, which is like,
So yeah,
wait a minute,
it
there's different levels.
is categorized differently. So you have stages and you also have types. So the stages of lipedema, you have in the very early stages, stage 1, where it almost looks like a normal person, but they may just have a little bit, they may be a little bit hippier, and but abdomen is going to be really small, flat. You're not going to really see unless you have the eyes for it.
Mm-hmm.
But they're already complaining of easily bruising. They may have painful sensation on the hips, and sometimes laxity of their joints, which is, they're hypermobile.
Yeah.
In the younger groups, I do see that. And when I do my assessment, I can check to see if they're hyperextending their knees, or, if they can palm the floor. They may have that, but they may not have everything else that goes with it in the early stages. Stage 2, you start to get a little bit more of the inner knee lobules. They start to grow. In stage 3, yes, definitely a lot more in the lower extremities. Upper extremities may be involved. And then on the 4th stage is where now you start to accumulate a lot more lymphatic issues. So you may see the feet involved as well with fluid accumulation, which is lymphatic in nature. So that is lipolymphedema combination. And then sometimes I get what I call the trifecta, which is your lipedema patient may have already a lymphatic component, and then they also have vascular issues, which is the phlebolymphedema.
Oh,
So if you have leaky valves, that will give you additional pain to your legs,
yeah.
accumulation of fluid as well.
Wow.
So, and then depending on where it is, some people just have it in the buttocks and thighs. Other patients have it only in the lower extremities. Some have everywhere, upper
Mm-hmm.
extremities, arms, the legs. And some patients only have it in like the lower legs.
Yeah.
So, the emphasis is for healthcare practitioners and for patients themselves is you really need to kind of arm yourself as to where do you think your staging is, and these are the great resources that the Lipedema Foundation has for patient. They
Yeah.
provide a lot of information for them. And go in there and look at it and do your research. It's so important. And when you go to a doctor's office, I always give my patients, if they're seeing a new doctor that has no idea what lipedema may be, or maybe they never heard of it, I give them the brochure from the Lipedema Foundation so that at least they'll have something that they can reference to. And I give them the little card which has the definition of lipedema on the back and their website so they can start looking into it. So that's
Yeah.
has for me to arm every patient with some form of information.
Absolutely. That's one of the first things I did too, is I was on the internet just typing away. Lipedema Foundation came up and it was just a wealth of knowledge for me. There were so many tabs. So if you're watching this, use them. Go to their website.
Absolutely.
Um, they have like a ton of information.
And
And especially I think the top question, and I'm seeing it here in the comments, everybody wants to know, how do you get diagnosed? Where do I go? What do I do?
that's a toughie
Yeah.
because far and few, especially, I mean, we live in the tri-state area here in New Jersey. I'm in New Jersey, and we have New York right next door and Connecticut. And you would think we would have a lot more practitioners and doctors that are aware of what this disease process is, and not label patients as obese, because the minute they see the weight, they put down a BMI that does not reflect who they really are. So, if I know that the Lipedema Foundation has a resource guide of doctors, they do provide some information, and
Yeah.
they can. Granted, I am a physical therapist. I can recognize it, but I can only make a differential diagnosis. I cannot make a diagnosis on medical basis.
Right.
And we are lucky enough in this area to have a few doctors that do recognize it. And so whenever I do get a patient that is sent to me and they tell me, oh, it's lymphedema, and right away I recognize that it's not, I make sure that I let that doctor know in my initial evaluation, this patient really presents with lipedema, and these are the stages where they're at and what my plan is for that patient. Because then that's how they can become aware of what's out there and
Yeah.
what the difference is. I feel, glad that I have educated quite a few of the vascular doctors in this area. Not that I went out there to tell them, look, you're doing
Right.
this wrong. No,
Right.
it's just by collaborating with them, it's like, yes, they do have vascularity issues, but in addition to
Yeah.
that, they
Well, if
also
you
have,
don't know, you don't know. Somebody's got to tell you to, the first time. You have to be enlightened to it.
right.
Yeah,
And
that's
honestly,
I. Oh, sorry.
no, I was going to say, my goal is to really get out to pediatricians as well, because you're seeing prepubescent, pubescent girls, and they may say to the mother, "Oh yeah, she's gaining a little weight. Let's keep an eye on what she's eating." Look at the mom. Does the mom have it, or maybe someone in the family? This should be discussed at the time of puberty.
It's
With
hereditary, right?
absolutely, yes.
Yeah.
So, and it doesn't mean that it's just on the mother's side, because I have quite a few patients that it's, oh, my grandma on my dad's side of the family
Yes.
had legs like mine. So, absolutely, I think it should start so much earlier, not wait till you're in your 20s, or you start, for instance, when young women start to go on their birth control, the hormones that activate all of this, that makes it actually go haywire,
Yes.
that's when they start searching for, oh, what's going on? Why am I gaining all this
Yeah.
weight?
Yeah.
So by then they already had the predisposition. If somebody would have caught it on earlier, maybe they could have said, oh, okay, let's go about it a little different at this point.
Right. And to avoid, like yo-yo dieting or thinking that it's just obesity or going down those different avenues.
Right,
I agree. I would have loved to know that I had this a long time ago.
right.
Um, that would have been ideal. So,
Yeah.
I wanted to go back and touch on the fact that you're a certified lymphedema therapist. And I read on the Lipedema Foundation's website that there is a like working backwards method to finding a doctor to diagnose you. And that's to get in with a certified lymphedema therapist and do exactly what you said. Say, hey, like I think I have this. And then they usually, like you, know a couple physicians in the area or somebody who can then work with you and get the referral. And so I had read that on the
Mhm.
website and that helped me immensely. So that's a wonderful tip if you're watching, because I saw some comments come through.
Yes, that is a great tip, because and look, because of social media nowadays, so many more women are becoming aware of it. And
Yes.
thanks platform as well, you're pushing information out there, which is great. So instead of like trying to search for a medical doctor, and I do get some patients that come and they're like, do you think you can diagnose? I say, well, I can only give you, a medical opinion based on my level of expertise, which is as a physical therapist, but I can recommend you for someone who
Yes.
understands it a lot better. And
So
it's interesting
important.
you're saying this working backwards. Just the other day, I put together a list of all the specialists that my patients have told me that they've been to. And, not just one patient, but like a combination of, I came up with 20 different, and I always say it's the 20 points away from getting to Omni Therapy Center, which is where I work, or to like an Instagram page where they would
Yeah.
find out. If we would start definitely backwards, it would be a lot easier, and it would save a lot of insurance money, because
Yes.
every doctor that sees them, if it's a cardiologist, they want to make sure that the heart is okay. So all those tests, they go on and they do that. Then they'll say, oh, it's a vascular issue. Well, sometimes it may be in combination. So they will go to a vascular doctor, the primary endocrinologist, chiropractor, physiatrist, everyone
The
in the
whole
book. I
list.
basically like what they told every patient. I definitely want to do something with that list and look into what the cost would be, if you add all these things
Oh,
versus
yeah.
get to the right source right at the beginning,
Yeah.
and we can have so much more availability of insurance coverage for other things they may need.
Oh yeah, just streamline the process. I know a lot of us are seeing general like healthcare practitioners. So what kind of information can we present just like our primary care provider with that can, I guess, kind of prompt them or like show them the right way to help refer us and get down that channel a little bit
Right.
quicker?
So the Lipedema Foundation has that wonderful brochure and the cards,
Okay.
and I arm my patients with that. So if they're telling me, oh, I'm going to a dermatologist because I have this little issue, I said, can you do me a favor? Can you bring this along with you? Just so that they know that it's not just a dermatological issue that you're dealing with, that you have this underlying condition called lipedema.
Yeah.
And even if, they go to, I just recently had a patient who went to a dietitian, and because her doctor told her, your BMI is high, you may need to go and talk to a dietitian, which I'm all for. The more help you get from the different resources out there, the better you can arm yourself of what to do instead of going to extreme things, right? So, and my patient, she's like, oh, okay, I'm going to bring the information you gave me. And she, unfortunately, she says, oh, no, I know you need to lose weight. Here's a diet. And didn't even bother to look at it.
Yeah.
And very frustrated. And I said, maybe I can reach out to her and ask her if she has worked with lipedema patients in the past.
Yeah.
Let's go about it a little bit different. And so I put in a phone call to the dietitian to see if, we can discuss this, because there are other dietitians that I do speak to on a regular basis because they're not as familiar. Yeah. So, I'm still waiting for her phone call, and I'm hoping that she does reach out to me before my patient goes back.
Yeah.
Because all she wanted to do was just write down what you're eating. And my patient's like, I could tell you eat very clean every day, and the weight doesn't move. And so I'm still hoping.
She's very blessed to have you as her advocate. I know.
Thank you.
You have to have someone in your corner. Not everybody does, and we are our own best self-advocate. So to be empowered with the knowledge and to hear this, be here on the live today, and just know these things is so incredibly helpful. Do you have a best tip that you would recommend to patients to be their best advocates, or what would you say to them when they're going through this and being told, like, you just need to work out, you just need to exercise, you need to diet?
Yeah. No, the first thing is, I want to put them at ease that, look, this is not your fault. This is not that you are doing this to yourself. And there are some things that can help you. It is going to be frustrating, but you need to try different things. And the other thing is inform yourself, do your research before you jump into anything, because let's face it, there's a lot of stuff out there that, they may advertise, and okay, maybe it works for one, but not for all.
Yeah.
So the best advice I can give every patient is you need to know your body, and you need to know what works for you and what makes things worse for you. So I always try to tell my patients, although, nutrition is not my thing, but I do enjoy learning a lot about it. I always tell them, I'm like, okay, pay attention to if you put something in your body and, 2 hours later, your knees are hurting, or you're having difficulty or gastrointestinal issues, write that down and try to avoid it. Kind of not an elimination process, but just know what are your triggers. Right. And the other thing too is you need to find something that you're going to find peace in, because you need to be calm in order to prevent that cortisol level from spiking. And I see it with a lot of my patients when they're under a lot of stress. I measure every patient. I measure their legs, sometimes their arms, if that's also an issue. And when I recheck and I say, oh, you're actually going down after like these treatments, or sometimes what's going on, because I see that the numbers have gone up. And that's when I get the opening of the floodgates about, oh, I'm under so much stress. This is happening in my family, with, myself, with work. A lot of issues with patients not being able, we're close to New York, unable to get into the city because you have to get on a bus or, from a subway. Yeah. It's very difficult for them. So knowing what your triggers are, finding peaceful moments in your life, and informing yourself of what works for you and what doesn't work, it's so important.
Yeah, I agree with just trying to be calm. I noticed that in myself, and unfortunately my life is filled with so much chaos, and so I feel like I'm just on this spastic, like always trying to stay calm and like do myself a service, and
Hmm.
breathe and just take a moment to just be present and not get so stressed out by all these little things because it does affect your health. I do want to share that I feel like there's a lot of hope with lipedema, just you being here today and the fact that it's being spoken about.
Yes.
50% of peer reviewed papers on lipedema were published in the last 4 to 4.5 years, which I think is absolutely incredible. That means there's a lot of research going on right now that's being put into the field, and education, which gives me as a patient so much hope,
Ab-
that there's going to be progress and more information and enlightenment to the community. What gives you hope or
Well,
makes you feel the most promise in the field of research with lipedema?
well, that's one of the things that gives me hope. I mean, just keep in mind, this was diagnosed back in the
Yeah.
1940s,
Yeah.
and it's taken all this time for patients to become their own self advocates. And I think, educating the new healthcare facilitators out there is so important. Whether it's, from nutrition, medical, everything. You want to encourage everyone to find out a little bit more about it. Don't just assume that
Yeah.
it's city. Uh, just know how to depict the differences. So that gives me hope that we have information out there, and it's at our fingertips. So if you encounter someone that may not be open to researching it, sometimes it's time to move on. And having a network of women like yourself, that you're providing for other women some hope, that to me is it's a big step. Which I've been doing this for 22 years, and this is my first time doing a live. This is very, very hopeful for me that the information will get out there.
Oh, well, I'm so grateful for your dedication to just serving your patients and helping them. And like you were calling the nutritionist, I would love to have somebody like you, standing behind me in my healthcare journey. So I know everybody watching today feels the same way. And we're just appreciative that, you're dedicated to helping these patients and the knowledge and spreading it. It's very powerful. So
Yeah,
thank
then
you.
they're all my good friends, all my patients, and if I can do something for them and help them through all of this, I'm there for them.
Awesome. Well, thank you. I know my best resource, for myself looking into lipedema was Lipedema Foundation, and I think that's yours as well. Is there anything else, we can direct anybody to for
Well,
resources?
that is the main resource. I mean, like I said, I keep that brochure on hand for everybody, even for the patients that have been diagnosed. So that is the go-to, and like I said, the Legato Library has so many articles out there. So in researching and, promoting yourself to become more knowledgeable, that is key. So I hope everybody
Absolutely.
keeps more.
Okay. Well, I'll tag Lipedema Foundation right here in this live, so you're going to be able to access it and utilize it. I'm going to save this live so you can come back and watch it. And I think we have some watchers, viewers who are commenting with questions, so we can go back. Well, I don't know the answer. You're the expert. But we'll get your questions answered. But the website, for the Lipedema Foundation is lipedema.org. And that'll be a treasure trove of knowledge for all of us. So, anyways, I'd love to thank you again for your time today. Anna, you are amazing. We're so grateful for you.
Thank you for having me. It was great. And
Oh,
thank you for spreading the knowledge as well.
thank you so
Thank you.
much. Okay, you take care. Thanks.
Thanks. Bye.
Bye.